Hello, and welcome to another NABBW financial Zoom call. Today, I'm with our regular guest, Pam Sams, for our annual Medicare update. We'll be reviewing the basics as well as learning about the changes scheduled to take effect on January 1st of 2025. That's a hard thing to say. I'm not used to saying 2025, but
Exactly.
Medicare, Medicare, of course, being the primary health insurance used by most Americans age 65 and older. So this is a big thing that we all need to figure out to make sure we're getting the most out of it. As Pam will shortly be reviewing with us, Medicare open enrollment has already started and is available to us for changes to be made or to enroll if we have never been a part of it yet between now and December 7th. And during that time, all of the more than 63 million Medicare beneficiaries can pick a new Part D drug plan, a new Medicare Advantage plan, switch from original Medicare into Medicare Advantage plan, or vice versa. Any coverage changes made during this period will go into effect January 1st of 2025, as I think I just said a minute ago. If you're new to Medicare, you're likely feeling overwhelmed. I know I was when I was new to Medicare by all the information you're receiving. And if it's renewal time, then I suspect that despite all the flurry of ads and public service announcements and the mailings that are coming to you, you're thinking that possibly it's just going to be easier to just stick with the coverage that you've got. After all, leaving things the same is always easier, but not necessarily better. In fact, Pam says not reviewing your coverage is a missed opportunity because, while it can be tedious to review all the mail that you're likely receiving about changes to your Medicare coverage, just choosing to stick with the status quo can be a costly mistake, especially because the options we can choose from have evolved again for this coming year. Each year, Medicare plans are allowed to make changes that could potentially increase your out-of-pocket outlay. And even if your coverage didn't change, your needs might be different than they were last year. For example, you might have gotten a new medical diagnosis that results in new medications and specialist visits that might be better covered under a different plan. But as usual, I'm getting a little bit ahead of myself. Before we dive into our coverage for today, let me introduce myself and properly introduce this call. I'm Ann Holmes, your moderator and the boomer-in-chief of the National Association of Baby Boomer Women, an organization dedicated to educating and empowering women at midlife and beyond. And with me to help us make the best possible Medicare decisions is Pamela J. Sams, BFA, CRPC, MBA, and trusted advisor to professional women. Pam is a chartered retirement planning counselor and NABBW's retirement planning associate. An expert in personal finance, she is the president of Jackson Sams Wealth Strategies in Ashburn, Virginia, and a monthly guest who covers important information related to money and financial planning. Welcome to our call. We're glad that you joined us for this important and informative call. Now, before we can launch into this discussion, I have one more thing to do. I just need to play this quick audio clip here.
Securities and investment advisory services offered through Osaic Wealth Incorporated, member FINRA SIPC. Osaic Wealth is separately owned, and other entities and/or marketing names, products, or services referenced here are independent of Osaic Wealth.
So, welcome to our call.
Yeah. Well, thank you very much for having me once again. It's that time of year, as you
Right,
explained before, where you turn on your TV and you're inundated with Medicare commercials, and
mm-hmm.
you open your mailbox and you're inundated with Medicare material. So I'm
Right,
glad we would have the opportunity to really share some content tonight on kind of what I call the ABCDs of Medicare, because you have all of these moving parts and nobody really, tells you how they work. You turn 65 or you age into Medicare, or you come off of credible coverage, and then all of a sudden, bam, you're into this new environment, and it's the wild, wild west. You don't know where to turn. So I'm glad
right.
we'll be able to shed some light on that for people.
Oh, I think that it's great that you do this every year, especially even though Medicare has been around since 1965,
Hmm.
the benefits have changed over the years. So,
Okay.
I
Hmm.
know that you've got 9 or 10 points that we are
Hmm.
going to cover, beginning with the really basics. What is Medicare and who is eligible?
Yeah. So Medicare, as you mentioned in your intro, is really the federal insurance program for individuals who are age 65 or older. It is eligible for some people who may have disability, but for the most part, it is the federal insurance program for people age 65 or older. When you turn 65, as I mentioned before, you don't necessarily have to take Medicare if you are still working. That's the misnomer. A lot of people hear, oh, now I'm 65, I got to go and sign up for Medicare. If you are still under credible coverage for your through your employer, if you're still working, then you do not have to sign up for Medicare at age 65. When you come off of your employer plan or the plan you're on, maybe a spouse's plan as well, then that's when you would seek out Medicare. So I just want to put that out there because a lot of people,
Hmm.
hear 65 and then go automatically to go enroll. But if you already have coverage, you don't have to do that. You are eligible once you reach 65 or have separated from credible coverage from your employer. So that's who are eligible for it. I'll go into a little bit into eligibility, a little bit with some of the other parts, but that's traditionally what Medicare is and who's eligible.
Okay. Well, then let's get to number two on your list of points to cover, which is that there are different parts. So,
Yes.
what are the different parts of Medicare?
Yeah, so the different parts make up Medicare. There's Part A, and then there's Part B, and then there's Part D, and then I have to go back and say C because Medicare, sorry, Part C is Medicare Advantage. They kind of got out of sequence. They went A, B, and D, and then they have Part C for Medicare Advantage. The different parts, I know we had talked a little bit about the different parts. So Part A is the hospital insurance. So that covers your inpatient hospital care, that covers hospice care, that also covers home health care. And then part B is your medical insurance, so your doctor. So it's going to cover
Hmm.
your doctor's visits, your ambulance, durable medical equipment. If you have, thing equipment that you need, part B would cover that part as well. And then part D is your prescription drug program. So that's going to
Hmm.
cover all of your Medicare, I'm sorry, your medication and your prescriptions for that.
Hmm.
And then Part C, like I said, is Advantage, but we'll talk a little bit about that in a minute.
Okay. Should we cover anything more about Part A, or have we pretty
Well,
much?
Part A, yeah, for the most part, Part A is hospital insurance. So you
Hmm.
pay into, well, I would say, quote unquote, technically free
Hmm.
because you paid into it through your payroll tax when you were working through your FICA. So
Hmm.
you see on your pay stub or your paycheck is FICA. A portion of that goes to pay for Social Security, and then a portion goes to pay for Medicare. So that's how Medicare is funded through your Part A is funded through payroll taxes.
Hmm.
So with your hospital insurance, you don't have to pay a premium for that because you've been paying along. But there are also deductibles for your Part A hospital insurance. Just kind of briefly go into it. There's a 16, at least in 2024. It may change slightly for 25, but roughly a $1,600 deductible from day one that you do have to meet if you go into the hospital for Part A. So though you're not paying any premiums and it's free, there is a deductible for in-hospital stay from day one, and then it
Hmm.
lessens as you are in the hospital a little bit longer. After 150 plus days, then Medicare will cover all of that for you, but it's incremental from the time you hit the hospital. It's a $1,600 deductible that you have to deal with.
All right. All right. Then Part B. What's
Yes.
involved in Part B? You said
Yeah.
that's
So that's
med
your, yes, that's your
physicians.
doctors. Yeah,
Hmm.
physicians. So your medical insurance, your doctor's visits, ambulance, durable medical equipment, as I mentioned before. Now, Part B has a premium. And Part B premium is based on your adjusted gross income each year. So it could change depending on
Hmm.
what type of income you take in any given year. When you first age into Medicare or come off of credible coverage, the Part B premium is based on a 2-year look back. So for 2024, it was based on your 22 tax return. 2025, it will be based on 2023. So that's how they price out the Part B premium from the beginning.
Hmm.
The lowest amount right now is about $174. Um, it it will change if you want to go and look at, I think it's Medicare.gov, what the Part B premiums will be in each year. I think it should be coming out. It actually is out because I saw it's about $185. It's kind of the base amount, but it depends on your what your adjusted gross income and your filing status. So if you're single, it's going to be a one amount for income. If you're married filing jointly, it's going to be a certain amount. And then, of course, if you're married filing separately, it'll be. But you just need to know that it is based on the adjusted gross income in each year for
Okay.
that. But Part B will have a premium. Part B also has a deductible that you have to be aware of as well. So Part B deductible is roughly, $500 or so for your Part B deductible before Medicare will pay into that. So
Hmm.
something to be aware of that there are deductibles that are involved with Part A as well as Part B.
Okay. And I remember my first year, I got so mad because I was healthy, so I didn't meet any of my deductibles. So that meant that Medicare didn't. I paid into my program that I
Mhm.
had purchased, but I didn't get any benefits from it. So I was kind of unhappy over over that, thinking that
Yeah,
I didn't get any
exactly.
benefit out of my insurance that I paid. But
Yeah, I know, and that's the thing about it is that, if you don't meet the deductibles or you don't go enough to, you pay into it, but then you don't actually get the coverage because you didn't meet the deductibles in that given year,
mhm,
then yeah, you seem like you that
right,
you're wasting your money.
right,
But it is there for your benefit for your doctors and things like that.
right.
And
And I told
you will
myself that
have you will have some co-pays and things like that, just
mhm.
like you would, with your regular program through your employer.
All right.
Hmm.
Now, should we talk about part C, or do you want to go over to D first?
Yeah, let's go over to D first, and then we'll come
Okay.
back because Advantage is a whole different animal in itself.
Okay.
But Part D is your prescription drug program.
Hmm.
And I believe that's been around, I think '05, it's fairly new. What happened
Hmm.
is that they had A and B, and then seniors were like, hey, what about, these drugs that we need when we have prescriptions, we need some type of way to pay for these. So they came up with Part D. So Part D is generally a standalone drug program. It is offered by private insurance companies. It helps pay for your medications. You can buy it through a pharmacy. You can do a mail order service. Part D also has a monthly premium depending on where you buy it from.
Hmm.
But if you do a standalone drug program, you will have be charged a monthly premium. But Part D is your drug program. So A, hospital, B, doctors, D, drug program.
Hmm. All right. And so then we moved along with that for a few years, but then
Yeah.
Medicare Advantage came along, and as you said, they skipped over the letter C, so they decided, hell, we'll
Yeah, so
stick.
they're like, hey, let's go back and do that. Let's
Right.
let's
Yes.
fill and see.
Right.
Yes. So I think this one's fairly new too when Advantage came out. So what happened is that the private insurance companies, they went to the federal government and they contracted and said, hey, we can administer Medicare better than you are. So
Hmm.
they came up with Advantage with Part C. So it is private health insurance companies that are contracted through the federal government to provide Medicare for you. So
Okay.
most people will probably hear Medicare Advantage or Original Medicare. So Original
Hmm.
Medicare is basically all of those parts we just talked about,
Right.
and then generally a supplement, which we'll talk about in a little bit, and then you have your Advantage plan. So Advantage combines the original Medicare services and some additional coverages and benefits such as vision, hearing, and also has a prescription drug program. So think of Advantage kind of like the bundle,
Hmm.
like when you bought your cable. A lot of people are not
Right.
having that; they're doing streaming, but you would
Right.
buy a bundle
Hmm.
that you would do. So they do A, B, and D all together under Advantage. Advantage costs and coverage can differ from plan to plan. Each insurance company has their own Advantage plan. So you just have to kind of compare what's in your service area that's available and then some of the or additional coverages that you want. So if you want vision and dental, some have health programs like Silver Snickers and things like that. So
Hmm.
you would have to really evaluate it from plan to plan based on where you are with your coverage. But just know Advantage is basically A, B, and D as a bundle combined.
Hmm. Okay. So then there's Medicare supplements. That's
Yes.
another topic. So,
Yes, so Medicare supplement is generally the piece that you would get to cover the gap that
hmm.
Medicare does not cover. So
Right.
Medicare covers 80% and then you're responsible for 20% co-insurance. So if you don't want to be out of pocket for a lot, that 20%, 20%
Hmm.
is different when you do a copay of $20 and it could be $5 versus you go in for a knee replacement surgery and your 20% is quite a bit higher.
Right.
So
Yes.
you want to get if possible, a Medicare supplement program. So that's basically would cover that 20% co-insurance. So Medicare supplements are also a standalone program that is regulated by state government. So if you go to, I'm in Virginia, you're there in Illinois, it has to cover the same features across each state, but so it's regulated by state government. It is an open network, so you can choose your own hospital, your own doctors that accept Medicare. There is a monthly premium, of course, with supplements, but you pay little to nothing to use the coverage. So it will
Hmm.
fill in the gap for that 20%. So if you go to the doctor, it will cover your co-pays. It'll cover, some of those deductibles that you had with Part
Right.
A. Same thing with B, things like that. So having a supplement along with your original Medicare then that could fill in some of that gap for you. Now, if you do original Medicare and you do A, B, and D and a supplement, you cannot have a supplement and Advantage at the same time. So either you're going to have original Medicare with the supplement plus Part D, or you're going to have Advantage, which is A, B, and D together, and then you wouldn't need the supplement.
Right. So I've chosen the A, B, and D with the supplement, and that means
Okay.
that I get letters from Medicare that tells
Hmm.
me what they've covered, and
Yeah.
then they tell me that this is the part that I will have to pay, and
Hmm.
then at the bottom it tells me this now has been mailed to the place that I use for my Medicare supplements. So
Yes.
you know, then the Medicare supplement takes care of that part uh, that
Hmm.
it works pretty slick for me that I
Yeah. Yeah,
right.
that you don't have to do that out of pocket. So
Right.
yeah, it can add up over time for people who do not have, that you used to be called Medigap, but now it's called
Hmm.
Medicare supplement.
Right.
so you can offset some of those expenses. It's not a requirement. You don't need it because a lot of people hear, hey, a Medicare supplement is not a requirement. It's just a nice to have to fill
Hmm.
in that gap for you.
Right.
But A, B, and D are the ones that if you don't have, there could be some penalties involved around it. But the supplement, it's one of those things that it's a nice to have. It's not a requirement.
All right. Now, you say that you mentioned earlier that you're in Virginia and I'm in
Hmm.
Illinois,
Yeah.
so our costs are going to be different. So,
Costs are going to be different. Yeah.
is there any
Hmm.
way that we can cover discussion here, or is it too much vary by
Um,
states?
It's gonna vary by state, but it's based on state, it's based on your zip code, but the different plans have different costs. So a Medicare supplement plan, you know, to confuse people even more, the
Hmm.
Medicare supplement plans also have letters. So they have
Hmm.
plan A through G generally.
Right.
So this is not part A, B, this is a plan A and plan B under your supplement, but it's based on kind of your zip code, your state, and and then what plan you choose. For most people, would choose Plan G because it's more inclusive. They used to have Plan F, but they don't offer that anymore. But Plan G covers a lot, your co-insurance for your Part B, also your deductibles for your Part A and B. It also has foreign travel involved. A lot of people like that, especially if you're going to travel outside of the country and then something happens to you in a foreign
Hmm.
country, having something that will be able to at least cover that and then send you home for extra coverage. I mean, extra care afterward.
Hmm.
But if something
Right.
happens while you're away, you need something to do that. So Plan G would be able to cover that through a supplement plan as well. But you definitely want to double check what the supplements. Each insurance company is also different. You have Aetna's, Humana's, United Healthcare. You want to evaluate your supplement plan to see what it does cover and see which plan would be best. It goes from plan
Hmm.
A, like I said, to G minus the F because they don't have that one anymore. But see which ones you want to cover because each one will be different as well. So plan A may be a little bit less expensive, but it may not cover as much. So go through what you want to have covered, the eight deductibles, the foreign travel, and things like that. And then can see which plan would be beneficial for you to get as a supplement.
Okay. Now, I am not sure if this is a place where I should ask this question, but
Okay. Mm-hmm.
I was recently sick and had to twice use an ambulance. And
Uh-huh.
then I obviously I'm healthy again. And in my mail the other day, I got a postcard from a place that wanted me to come and go to a free luncheon where they're going to tell me
Mm-hmm.
about ambulance costs. So
Yes. Yeah.
apparently they figured out that I use an ambulance, so they think that I'm a ripe for
Yeah.
wanting to know how to not have ambulance charges. But is
Yeah.
is ambulance costs, are they covered under Part D, or where?
So your Medicare Part A should cover no, I'm sorry,
Ambulance.
your B should cover your ambulance
Okay.
costs with that. So that's the premium you pay to Part B, but they should
Hmm.
be able to cover the ambulance cost for
Okay.
that. Yeah, ambulance costs are really different because of course you need it, but
Hmm.
sometimes they're private outside of the hospital, and then it could be a whole different thing. So definitely
Right.
check where the ambulance coming from. I know you can't because you're in, but that's
Right.
probably where that seminar came from because sometimes people get caught with it was a private ambulance service versus
Right.
that provided by the hospital, and then who's going to cover it, that sort of thing. But for
Exactly.
the most part, Part B will cover the ambulance.
Okay. All
Hmm.
right. Well, I knew I hadn't seen any bills for the ambulance yet, so I figured somebody
Hmm.
covered it. I just didn't
Yeah.
quite know who, so I was curious about it. And
Hmm.
yes, I had an ambulance first hospital that I went to, and then I had a private
Okay.
ambulance when I got taken out
Yeah.
of state. And
Hmm.
so I know the private ambulance was a much nicer ambulance, but I'm
Hmm.
sure it was also a much more expensive
Exa
ambulance. But right.
exactly. Exactly. Yeah. So that is supplement. We had talked about that, and then we talked
Hmm.
about advantage, and then we talked a
Right.
little bit about cost.
Okay.
Um, and then so where are we in our
I
discussion?
think I think we're probably about it, discussing important dates and enrollment and then changes for 2025. But
Okay. So yeah, kind of before we get into, well, we could probably get into the enrollment because I can talk a little bit about
okay.
some of the
Yeah, we've
penalties.
got some important dates and penalties
Yeah,
if
it's
we don't
important
meet the
dates.
dates. Right.
Exactly. And that's why people are so, so scared with enrolling right at 65 because they hear,
Hmm.
oh, I need to do it because there could be penalties involved as well.
Hmm.
But before I get into some of the important dates, a lot of times what the biggest question I get is, should I do this original Medicare or should I do Advantage? What are the pros and cons? Really to determine what option is best for you. Advantage is really good for people who want a lower monthly premium, are comfortable with, okay with paying the co-pays and deductibles for their healthcare service, really comfortable about seeking care within their own defined provider network because sometimes you have to stay within network with Advantage. And then you want a
Hmm.
prescription drug and extra benefits that are kind of the bundle included with that.
Hmm.
Uh, Advantage are really good for those comfortable with maybe paying a little bit higher monthly premiums in order to limit the out-of-pocket spending on their health care. So as I mentioned before, you may pay a little bit higher premium for the supplement, but you're not going to pay the Part A deductible, Part B deductibles, things like that.
Okay.
You also, want some freedom to access doctors, hospitals throughout the U.S. Gives you a little bit more flexibility, and you're not kind of just within that service area that Advantage
Hmm.
may put you in. And then you are willing to buy some extra benefits separately because you may have to add on a vision or dental program for
Hmm.
your supplement with that.
Right.
But those are kind of, some of the things to weigh. I always say, if people are going to the doctor a lot, those co-pays can add up over time. So Advantage may not be a beneficial because, you're paying $30 every or 30 or $40 every time you go to the doctor. And if you
Right.
go several times a year, that
Hmm.
can add up versus, you paying a little bit more for a Medicare supplement premium and getting those co-pays taken care of. So it's up to each person, it's no right or wrong, but really evaluate kind of how often, you're going to the doctor, also your prescriptions, because that can change as well. So speaking of prescriptions, a lot of times I had this conversation with a client the other day is that, during this open enrollment period, things change, things come off your formulary, things come on. So you don't want to get caught by surprise because you kind of let it ride and you didn't want to make any changes because you didn't want to upset the apple cart. But
Hmm.
January 1, you go and fill your prescription and then find out that particular prescription is not covered anymore.
Right.
So you want to evaluate, even if you decide to stay with your current Advantage plan or current Part B or Part D plan, look at it. They are obligated to send an updated formulary or at least send you a letter saying, look at the formulary because it is a big
Right.
booklet or
It's
something.
a
But
yeah.
they may send you to the website and say, hey, look at it. So don't ignore those letters that, it'll say
No.
something about, prescriptions or we making some changes to the formulary. Take a look at
Hmm.
that because your things can pop off. Case in point, my husband's asthmatic, so, there one prescription for one of his asthma medicines or insurance company. I'm not on Medicare, but just in general. Um, One of the prescriptions they're not covering anymore. So either we go back to a doctor and say, or is there something
A
that's
different.
comparable,
Right.
or we pay out of pocket, for
Right.
that, and depending on, how he receives it, we end up having to pay out of pocket for that because it was better for for him. So now, it's a little bit more than what we would normally pay for it. But that's especially with people, retirees who are on fixed
Hmm.
incomes, you don't want those surprises that pop up. Now
No,
you
no,
were paying $30 and now the prescription that you have to have daily is more like $300. That's a big
exactly.
difference.
Yeah,
So you want to look at that.
we have a situation like that where there's
Yeah,
a particular prescription that my husband takes that
yeah,
there are generics for, but the
yeah,
generics don't work for him. He has to
yeah,
use the
yeah.
original one, and
hmm
the original one, of course, is not as low price as
Yeah,
the
not as
generics
low
are.
price. Yeah,
Right.
exactly. So yeah, so that's what I see people make the mistake a lot is that they kind of let it ride and then they don't reevaluate
Hmm.
the drug program part of it. And because,
Right.
or even the ones that, kind of on the reverse side, you may have been paying a little bit more, but now that particular drug is in a generic form now. So you may want
Hmm.
to take a look at the generic and get the lower price as well. So
Right.
that's the mistake I see a lot of times is people being, oops, now I'm at the pharmacy and things are more than I thought it was going to be, type of surprises.
Exactly.
So in terms of kind of important dates for people to remember. The
Hmm.
first one is the initial period. So the initial period is really when you first age into Medicare or you come off of the credible coverage. But I'll talk a little bit about that separate. But when you first age into Medicare, that's your initial enrollment period. You basically have 7 months. That's 3 months
Hmm.
prior to your 65th birthday, your birth month, and then 3 months after your 65th birthday to sign up for Part A and enroll in B. Like I say, at Part A, it is free, so you can
Hmm.
activate that, at 65 if you are still working. But, I'll talk a little bit about some reasons why you may not want to. But Part B, you do have to sign up. So, because you've come off of credible coverage and you've
Hmm.
aged into Medicare. So if you don't, there is a penalty if you don't sign up within that 7 month window. It is usually about, I think it's, I want to say 5 or 10%. I can definitely clarify that. They change it all the time, but it is a permanent thing. So then you end up paying a little bit higher in your Part B premium because you didn't sign up when you were supposed to.
Okay.
So you don't want to get caught in that.
That one.
Your special enrollment period, that's basically that for people who are 65 and older, you experience basically a life event. So you've come off of credible coverage through an employer plan, through your spouse. You lost coverage. Because your program doesn't exist anymore. You basically have 8 months after to enroll in regular Medicare, and then 2 months after to enroll in a Medicare Advantage or adding on any other plans. So you get a little bit of time to do your special enrollment period. And then you also have the annual enrollment period where we are now, basically your
Hmm.
October 15th to December 7th to make those changes that you mentioned in the intro. You want to make a change to your Advantage plan so you can go from Advantage to Advantage. You don't like your Advantage plan. I want to go back to original Medicare. You can do that. Vice versa. I was really original Medicare. Now I want to go into an Advantage plan. So that's during this annual enrollment period, you get a chance to make any changes and adjustments to that for that.
Hmm.
Um, Part D, same thing. There is a penalty of 1% penalty. So you pay a little bit higher if you don't roll in Part D. The thing about Part D that I get a lot of times is like people are like, hey, I'm healthy. I'm not on any drugs or any prescriptions. Why the heck do I have to sign up for Part D? Because you know, later down the road, if you
Right.
do decide, I mean, now you need prescriptions and now you're in the penalty box.
Hmm.
Use
Right.
a hockey metaphor. Now you're in the
Hmm.
penalty box
Right.
because unfortunately, you were healthy. I mean, I guess they penalize you for being healthy. Well, anyway, I wasn't
Hmm.
healthy the time I signed up. I don't need prescriptions, but now, several months down the road or several years down the road, you want to sign up for Part D, they're gonna gig you on that penalty for not signing up when you were eligible first eligible to sign up for
Hmm.
Part D. I know it's not fair for people who are healthy and no prescriptions, but it is what it is. But
Hmm.
that's how it is. Um, so we have that. So speaking of kind of this Part D and Part D premiums, for people who are making a little bit more money, there's people, you may have heard the term IRMA. It's basically the modified adjusted gross plus a little bit more. So you end up paying a little bit more in premium for your Part D as well as your Part B because you're in a higher income bracket, unfortunately. So I did have that case the other day where we talked about the 2 year look back. Um, she is yeah, she's 66 now, so she signed up last year. So they looked at 2022 tax return. Unfortunately, in that same year, she sold a house. She had a case in point. She went from what would have been base, where her normal salary is, at 174, and she's paying more like $500 for Part B premium because she had a life event that caused her adjusted gross income in that given year to be higher. So if you think you fall into a one-time circumstance where, hey, not going to happen ever again, my monthly salary is or income is going to be be different, you can go and appeal what they call the IRMA surcharge on any given time. So I did tell her to go back and do that because now she's nowhere near what she had in 2022,
Right.
and she's still paying 500, 550
Ooh,
for her
that sounds
Part
like
B
a big
premium.
ouch. Yeah.
That's a big ouch versus the 174 or 185 that she could be paying. So
Hmm.
it does take a little bit of time to appeal, but you can appeal. You go to the Social Security Administration. I know it's kind of a misnomer that you go take care of Medicare and sign up for Medicare through Social Security, but that's the way it is. So you would go and you would basically file a form for an appeal for the IRMA surcharge, so you can lower your premiums for that. So that's what happens. Sometimes people go, it is what it is. I'm just going to be paying this, but and don't know any better. But you can
Hmm.
go and do an appeal to see if you can lower your Part B premium at any given time based on a life event, life change. But if you're just
Right.
in a higher income bracket, unfortunately not. But if you
Hmm.
have one of those things where you took extra income when you sold a property or whatever, and that's a one-time event that's not going to occur on a regular basis, you can go back and appeal, for that.
Okay. Well, I'm glad to
Okay.
know that I didn't remember or know that if you've told me that before, I'd forgotten. So good to know.
Yeah. Yeah. And that's why I said a lot of times people, with Medicare, you just kind of accept it and you just move
Hmm.
on and you can complain about paying premiums, but you can do something about it if you need to,
Okay.
do something about it. Some um, mistakes to avoid, as I mentioned before, enroll during the right time to avoid the penalties. And if it is 10% each year for Part B, I thought it was.
Hmm.
And then you can also leverage state assistance programs and savings based on your income. So if you're a lower income, you can also go to seek state assistance and savings programs to kind of lower some of your costs as well. So back to that kind of that part A that I talked about.
Hmm.
If you want to activate part A and you're still working, because that's that free part, you won't want to do B because then you will be paying for your employer plan as well as your part B premium.
Right.
You don't want to double pay, but part A you can. But the caveat for that one is that if you activate any parts of Medicare and you are saving into a health savings account through your employer, that has to stop. So what happens is that you would have to stop your HSA
Okay.
contributions because again, they will also penalize you
Okay.
if you do it. So once you start that any like I said any parts enrollment, then your HSA contributions have to stop. It is backdated 6 months to give you 6 months of benefits, but then you have to go and take out. So it's a 6% excise tax on any income tax for those continuing to contribute to an HSA or contributing to an HSA during that time period, that 6 month time period where you should not have been contributing because you activated a Part A or Part B part of your of your Medicare. So be aware of that. A lot of people, don't know that piece. So stop your HSAs if you are going to activate any parts of Medicare. If you don't, if you want to keep your HSA, then don't activate any Medicare parts until you are actually eligible and you come off of credible coverage through your employer, and then you are actually in the Medicare system.
Okay. Now, I've heard of people that retire and then
Hmm.
they decide I don't like to be retired because I got nothing to do. So then they start being an employee again. So is it possible to get back onto the HSA if you have employment again, or how does that work?
Yeah, generally not. What will happen is that if you decide I want to go back on, Medicare will still be your primary, and you can have the employer plan be your secondary.
Okay.
But the HSAs generally will stop because you are still Medicare will be primary.
Hmm.
Um, so you've
Okay.
activated that. But you can,
Sure.
do the health insurance through the company. Just it will be a
Hmm.
secondary program for you.
Okay. Well, that makes sense.
Mhm. Yep, exactly. Um, I just wanted to make sure I had one other thing. Oh, Medicare supplements, plans, just kind of bounce back to that. Um,
Hmm.
Medicare supplements, if you are, again, age into Medicare at 65 and are come off of credible coverage, and now you want to do original Medicare A, B, D, and the supplement, you have a guarantee issue during that 6 month window when you first age into it or come off of credible coverage. After that, you may be subject to medical underwriting. So be very careful with supplements, especially during an open enrollment period like this. You say, hey, I'm on original Medicare and I want to go to Advantage. You do
Hmm.
Advantage for a year and you're really like, I really don't like this. I want to go back now to original Medicare with my supplement. Now you could be subject to medical underwriting. So be very careful if you're going to make any changes and adjustments because be aware of your health status if you decide to forego your Medicare supplement during the guarantee issue period.
Okay. That's an
Okay.
important thing because you don't necessarily always know what your future health is going to be.
You don't know. And if you're subject to a medical underwriter, then you may not be eligible at that point.
Hmm.
They have the opportunity to say no. And so now you don't have a supplement plan and you may be kind of forced into Advantage to cover some of those extra costs
Hmm.
for you. So that's why I said, nobody has a crystal ball. We don't know what your future health situation is going to be about, but definitely be cautious and know that could occur if you make any switches or adjustments to going from original Medicare to Advantage and then Advantage back out to original Medicare at some point.
All right. Any other important dates when enrollment issues, or should we move on to talking about Medicare changes for 2025?
Yep, those are the main ones. Your initial, and then your annual, and of course your special. When you come off
Hmm.
of credible coverage and you want to, um, make adjustments and changes to that. Hmm.
Okay. Well, I'm curious as to what the changes are for 2025 because I heard there's something where I can spread payments out, but I don't remember all the details of that.
Exactly. So the big one is, as we approach 2025 is really elimination of the donut hole finally.
Ah, okay.
Finally. So you won't spend no more than 2,000 for drug copays or co-insurance under Part D starting 2025, and we've phased out of that god awful donut hole.
Excellent.
So that's the big one. Um, Medicare Advantage plans also include Part D may raise costs or reduce coverage, unfortunately. So they are reevaluating some of those out-of-pocket caps and costs for Medicare Advantage plans. So this is a time to evaluate your current plan to see if there's going to be any adjustments to costs, either increases or decreases. Decreases would be better.
Hmm.
You can choose to pay your drug copays and co-insurance over time. So that's what you were talking about, kind of spreading your
Hmm.
payments out. So you can spread out the cost of medications over a period of months rather than paying for everything at the time of prescription. If you want to do that, the optional pay plan can ease, a lot of seniors
Hmm.
who are on fixed income budgeting, especially for those more expensive drugs that we had talked about as
Right.
well. So that's a good thing that they have coming down. Part B and Part D, I'm sorry, Part B and standalone Part D premiums may change. They haven't been announced yet, but some of the premiums, again, like I said, could go up a little bit. I know I've seen Part B, the base being from 174 now to 185. But Part D premiums is going to go up a little bit as well. They usually come out with it between and during sometime during this open enrollment. So, listeners definitely look out for the new premium increases for Part B and Part D. Um,
Okay.
you're gonna receive a mid-year notice sometime next year about unused Medicare Advantage benefits. Um, so what they're looking at is some of those supplemental benefits, such as your vision, dental, that you haven't used in the first 6 months of 25. So they're encouraging you to kind of use them, to use your benefits.
Hmm.
Any what they call unused or unspent funds can begin to be funneled back into marketing efforts. So there's like, hey, if you haven't used them, we could, uh, take away some of these things if you're not using them in order to
Hmm.
kind of put more into the program. So just kind of be cognizant that that could happen. There is also now an access to mental health professionals that may increase. Before, they weren't covering, a lot of healthcare providers were not accepting Medicare, but now you can enroll as a Medicare provider, or some of the healthcare professionals, mental healthcare professionals can enroll as providers and accept Medicare. That's a big one because a lot of people do need that service and may not have been able to get it because a lot of those providers weren't enrolled Medicare providers as well. So that's a
Okay.
good thing.
Hmm.
Um, and then the Medicare Advantage plans could also examine the impact of prior authorizations. This prior authorization thing is really, going through having to go get authorization every time you get surgery or, a prescription change or whatever. Um, so they're kind of looking back to see what type of authorizations you've had in the past on those higher cost services,
Hmm.
to really kind of manage the healthcare usage and lower the cost. It's all about the insurance company trying
Right.
to maximize their thing. So
Maximize.
there
Right.
could, yeah. So there could be some things there as it relates to prior authorizations. But those are, kind of some of the changes. The big one definitely is, getting rid of that donut hole.
Hmm.
And then also, offering now some mental health services, allowing some of those mental health providers to accept Medicare as a provider with that. Um,
I think that's so
and then,
important.
yeah, yeah, exactly. And then spreading out the cost because these drugs are getting outrageous with out-of-pocket costs.
Hmm.
Even if you've closed the donut hole and you got capped it at 2,000, a person on a fixed income is really, you have to watch every penny. And
Hmm.
going from one drug to another drug that's now, a difference between $200 or more could definitely shift your budget. And so
Right.
allowing you to kind of spread it out over time is also a good thing for people on fixed income. So I like that they have made some adjustments and changes and that they're actually listening to people who are retirees who
Hmm.
are having challenges covering their prescriptions these days.
that sounds like good news,
Yeah.
especially uh, because I know, especially if you are on a fixed income, this is, you know, I've started to figure out that everything is only going to go up. So it's nice to know that
Yeah. Yeah,
nice,
that yeah,
nice.
that you're there that to do
Hmm.
that, and especially, as a as an advisor, I kind of, the taxes go up, prescriptions
Hmm.
go up, and people on fixed income, you start eating into their monthly budget. It's not a whole lot of wiggle room that you
Right.
can make adjustments to. Um, so yes, at least easing it a little bit for prescriptions, or looking at some of the generics if there are available. Hopefully, there'll be some switches. But
Hmm.
that's what I see a lot of times, especially those January surprises that people didn't look at their formulary and now their
Right.
prescription may not be covered and or it went up because now they don't have a generic version. Now you're on the tier four, which is, or,
Hmm.
the highest
Right.
part of
The
it.
highest part. Right.
Yeah. So you have to kind of take a look at that and don't take it for granted. So
Right.
evaluate your programs, even if you decide to stay with your Advantage program or your current Part D program.
Hmm.
Look at the notifications that come in the mail because this is the time where they send it. We get a lot. People are inundated with a lot of mail, and you may just toss it because you're like, oh, I've seen that before. Open your mail, go through it,
Right.
make sure you
Yeah.
understand what's going on with your benefits as well.
Absolutely. And I have noticed that in the past, I'd always gotten those big, thick formularies
Yeah.
shipped to me. But this year,
Yes.
everybody's telling me go to the
Yeah.
website.
Go to the
And
website. Yeah.
so
hmm
I have to say that I have got the three pieces of paper that tell me go to the website. I've got them, but I haven't gone to the
hmm
website yet. So, but I still figure I got a few weeks. I got a few
Yeah,
weeks
you got
to,
a few weeks to
right,
do it, but at least you got the
right,
notification. Hey, go to
right.
website,
Hmm.
to do so. And so don't ignore those. Go to the websites you want to, go through. I know a lot of the insurance companies have prescription calculators. So, you put all of your prescriptions in, they will be able to give you an estimate of what
Hmm.
your annual cost or monthly or annual cost could be for your particular prescriptions that you're on. So again, no nasty surprises. You'll get an understanding on that, and then that's where it'll pop up if you put in your prescription, and then all of a sudden it says this is not covered, or now it's going to be this price. At least
Right.
you have some foreknowledge on what's going to
Hmm.
happen with your prescriptions. Hmm
Another thing that you said that was really crucial to me is I have a sister who I've been so jealous because she told me that she has no prescriptions. But
hmm
now I'm thinking, okay, so she's on Medicare, but I wonder if she knows that she should have at least signed up for Part D, even if she doesn't have any
hmm
prescriptions, just so she
Yeah.
doesn't have a surprise later. I'll have to talk to her about that.
Yeah, talk to her about that. I think it is definitely so unfair, but it's just a way to get around it. I guess they figure, at some point, people if you're 65, you should be on some prescription. I know. I don't
Right.
know.
That's
I don't know why that's his name,
right.
but that's probably what they're figuring,
Right.
with that. But yeah, you may want to at least have her take a look at it, or at least
Hmm.
be aware that there could be some penalty if she didn't sign up for it.
Right.
Mhm.
Okay. Anything else that we should cover at this point?
No, I think that's it. I know it's a lot of information. I just
Hmm.
recently did another presentation on Medicare because just kind of during this whole enrollment period, people ask for it. It's just a lot that people just don't know.
Hmm.
Same thing with Social Security, same thing with a lot of things that you have to deal with as you plan for retirement. Um, and so, I'm just out here educating as best I can.
Well, I appreciate that. In fact, I want to thank you because I
hmm
know you've helped a lot of people here who have been confused by the ins and outs of Medicare. And
hmm
as usual, you've given us a wonderful service with the information that you've shared. I thank you for being
Thank
our
you.
monthly guest and
Mhm.
providing us with this excellent review of what Medicare looks like and what we need to think about and be aware of for 2025. Um, so now I want to tell all of our audience, thank you for joining us for this great call with Pamela Sams. If you have any questions for her after the call, feel free to email them to Pam at Pamela@jacksonsams.com. That's JACKSONSAMS.com. Or go to her website at www.jacksonsams.com. You can also get answers at www.mymedicare.gov or at medicare.gov/blog.
Mhm.
And if you'd like to know more about the National Association of Baby Boomer Women, check out our website at nabbw.com. Our Facebook page is at facebook.com/nabbw. And it'd be wonderful if you have an interest to know more things that would be of interest to baby boomers. Check out a new website I've been a part of the development of with several other baby boomer focused experts, which is located at www.babyboomer.org. There's lots of content and information there. Um, so, other than that, um, I know that we are not going to have a call on the fourth Thursday of
No,
November
not
because that is
Not
Thanksgiving.
Thanksgiving.
So, so Pam and I will get together, audience, and figure out when we're going to have a November call, and we'll let you know. But other than that, thank you, Pam, for being here and talking with us, and thanks, audience. And so I'm going to say good night to everyone now, and we'll talk to you next month.
Okay, great.
All right.
Thanks. Alrighty.
Bye.
Bye-bye.
Thanks.